So, Dr. Pradeep Makwana, the gutsy guy, you are an embryologist, right? So, please tell to our audience that what exactly an embryologist does.
I make babies in a lab.
That's a good answer. That's a good answer. Alcohol and smoking has become a part of lifestyle for a lot of people. As an alcohol, तो एक socializing का norm बन गया है. You know, people would chill, relax, and a lot of people have taken it as a stress buster as well.
With alcohol, I would say that like people are gonna have it either way. Even I personally do enjoy a glass or two every now and then. You have to keep it as a social thing. If you rely on it to get you off your stress,
correct.
That's the road you don't want to go down.
Mm-hmm. Is it true that the length really matters, and does it anyhow affect with the the production of kids or anything?
The whole idea that the size matters is because of the adult movie industry, where people are made to look a certain way. And not just for men, even for the women, they also everybody is made to look a certain way, and people are like, okay, maybe this is how everyone should be. Everybody should have a perfect body, and that's not what happens in real life.
There's so much rising cases. We hear that about autism, about ADHD, and things like that. Is there a role to play about the not very good functioning sperm on this? Why is infertility rising in India? Having a baby, it's supposed to be one of the most beautiful thing in the world, right? But for more and more couples these days, the dream of starting a family is becoming an uphill battle. Have you or your friends have been hit with the painful reality of infertility? Maybe you have witnessed the emotional toll it takes, the endless doctor's visit, and the invasive treatments and procedures, all while desperately hoping for that long-awaited positive pregnancy test. The truth is, infertility is on the rise, and it's not just affecting older couples anymore. Younger generations are increasingly finding themselves faced with the heartbreaking challenge. In fact, get this. According to Centers of Disease Control and Preventive, a staggering 12% of women between 15 to 44 years old in US alone struggle to get pregnant or to carry on pregnancy for long term. The millions of people dealing with the physical, emotional, and financial strain of infertility. And it's not just a US problem, it's a global issue, with infertility rates climbing steadily worldwide over the past few decades. Experts point to a range of factors like lifestyle choices, environmental exposures, and a trend of delaying parenthood until later in life. So, what's really going on here? Why is something that should come so naturally becoming such a daunting challenge for so many? That's exactly what we are going to unpack in this eye-opening podcast. I'll be joined by renowned Dr. Pradeep Makwana, a consultant embryologist, a sexual health expert who will guide us through the prime reasons behind this trouble raising in infertility. From lifestyle impacts to the latest advancement in embryology and assisted reproductive technologies, we are going to dive deep and get real about this taboo topic. Because here's the thing, infertility isn't just a physical condition, it's an emotional roller coaster, and that can shake even the strongest relationship. It's a journey filled with frustration, disappointed, and sometimes even shame and stigma. But it doesn't have to be that way. By bringing this conversation into the open and arming ourselves with knowledge, we can start to break down the barrier, challenges, and the myth, and empower couples with the tools and support they need to navigate this difficult pain. So buckle up, because you are about to get real, get vulnerable, and get informed on all things infertility, reproductive health. Your journey to parenthood starts here. So Dr. Pradeep Makwana, the gutsy guy, because your social media is raging, the kind of content which you create is absolutely, one requires a lot of guts, I must say. Tell us, you are an embryologist, right? So please tell to our audience that what exactly an embryologist does.
So in the simplest of words, this is what I think of when anybody asks me what an embryologist does.
Yeah.
Is I make babies in a lab.
That's a good answer. That's a good answer.
So essentially, just to shed a little light, because people can take it out of context,
Yeah.
we take eggs from the ovaries, we take sperms out of the body, and then we will fertilize it in the lab. We will let the embryo grow, and when it reaches a certain stage, we will transfer it back to the uterus and hope that it results in a pregnancy.
Yeah, I mean, that is so pure and good experience when you see smile on your patients. Uh, so you do run a lot of IVF centers as well, right? And you must be having this kind of joy a lot more.
That's true. I mean, no matter how many years it has been in the field,
Yeah.
when you see, because you see the struggle of the patient, you see what they're going through trying to get pregnant, especially in our society where a lot of times there's a lot of pressure put on people to get pregnant. So once when they do get pregnant, when they do have a live birth, it's amazing. It's just the best.
Absolutely. Tell me, Pratik, where do you find so much guts to make these videos? Because the kind of topic which you do, I mean, मुझे याद है when I was small, I mean, वो दीवारों पे लिखा रहता था गुप्त रोग विशेषज्ञ, and because people, men, women, everyone is very scared to talk about, so intimate and so, but you are out there explaining everyone, and I'm sure a lot of people are reaching out to you asking so many questions. Where do you find that guts, and how did you decide, okay, I need to spread awareness on this subject?
So I think for me, because I grew up in a household where both my parents are doctors, so for me, it was a pretty normal
Normal thing.
conversation, because even when I was a kid and when they would talk to me, they would explain it to me in a very scientific manner. So for me, it was never a taboo topic growing up. Of course, I had friends, and when you get influenced by friends,
Yeah.
certain things become a little taboo, and they seem a little wrong. But when you grow up, you realize that no, I mean, portrayed in a certain way, yes, they can come across as wrong. Portrayed in a more informative, educative way, with the intent to educate, you'll realize that no, this is all pretty normal. It happens in human bodies, and the best way to learn about this is to know more. The more you know, the safer and the better you'll be. So yeah, I think that's how I started. Kabhi kabhi, I get a lot of galia on me in my comments
I'm
when we
sure.
talk about all
Yeah.
this stuff, but that's okay. That just
Yeah.
comes with it.
Because accepting this kind of topic,
Yeah.
which is medical and one needs to know a lot of mindsets, or maybe have various kind of
True.
mindsets,
True.
but it is so important to learn about these subjects so that one doesn't go wrong. For an example, school may there was this sex education, which was also kind of a big thing in school. Oh my god. And a lot of anyway, I mean, including me, I mean, I can speak from my experience also. We were like, oh my god, oh my god, aaj ye ho raha hai, and all. We used to go at the last bench and we'll sit quietly. Okay. How do you take these kind of things, if people would ask you that, okay, you have to go somewhere and give education on that, or what would be your reaction, and how would you do it? How would you calm down the kids, particularly the teenagers who need to know that?
I think if I was asked to do that, even my alma mater, my school has reached out to me to like come and talk, and I would be happy to go and do it, because kids are the most impressionable minds that we have.
True.
And I always say this, that the two impact points to improve sexual education and the awareness around it is the house and the school. Your parents and teachers are the best possible exposure points. Otherwise, you'll have your friends, and that never ends
Yeah.
well.
And everyone is researching in the peer group.
Yeah,
Yeah.
research.
Yeah.
So with that, when schools implemented these sex education classes, they were very superficial, very redundant. A lot of this was because the parents were pretty against it included in the in the school syllabus. And every time, I'm sure you must have noticed this, that whenever there's a guest coming to talk about menstrual health, all the boys are like, "Tum class ke bahar jao, ladkiyon se baat karni hai."
Yeah, yeah,
What's the
that
sense of
happens.
it? That's
Exactly.
I mean, we're not helping anyone in that case,
Yeah.
because then you grow up and then there's so much stigma around periods. It's because those little kids were never sensitized to it.
That's true.
Yeah.
And then you get to know from your wife or girlfriend, and they are like,
Yeah,
ooh, what is
like what is
happening?
happening?
And that kind of emotional support is lacking.
Yeah, and plus when little girls see that happening, it's sort of ingrained in the system that ये सब ये खुल के बात नहीं करनी है. So it becomes, it becomes a little problematic then.
No, you're so right. I mean, आज भी ये subject, whether it is men's sexual health or women's sexual health, and people don't talk about, or if somebody is talking, will be like, "Ooh, why is she saying this? Why is he saying this?" Uh, but let's say if the kids come to you, the teenagers come to ask you various questions. Again, like the example which you gave, कि menstrual health की बात होती है, boys are sent outside. Have you faced any incident like that कि okay जब ये sexual health आप पढ़ा रहे हो, some kids are very curious and some are a little shy or move out, or I mean, what?
So for me, because I've only taken a few sessions for kids, and they were mostly with an NGO during the COVID time,
Okay.
on through Zoom.
Yeah.
I didn't really face that problem, but maybe say if I go somewhere and I'm asking the kids, and that could happen, and I'll probably think on the go on how to handle it. But I've seen a lot of people I know, a lot of my friends, when they go and give lectures, I mean, the kids are always eager to listen, because for them it's something new, for them it's fresh.
Yeah.
For them there's no taboo around it. It's just any other thing that they're learning, especially when the kids are like around 6-7 years old to 14 years 15 years old. For them it's new, they're open to learn, they laugh, they'll giggle a bit, but they'll be open to learning. It's the
That's true.
people, the teachers and the parents around, standing around, they would be thinking, ये क्या पढ़ा रहे हो, क्यों सिखा रहे हो?
You're right. I think you're so right. I think, I mean, kids are a very at sensitive age. They're okay to learn and new things, and that's how the society will change. Speaking about kids, your one of the strongest subject is men's health, right? I would like to ask you that how growing up one needs to take care of their health, and how age changes the things.
So I think in women it's a completely different story, because women are born with a limited number of eggs, and as age goes on, the number would only decrease, it will never increase. For men, as they grow and when the sperm production starts, that happens every day, till the day you're no longer alive. The fact, it works like a factory, it is churning out sperms every single day. Now, in men and in women both, I'll just address both on the same blanket.
Yeah.
The most cliched advices that we have heard, कि खाना ढंग से खाओ, थोड़ा physical activity करो, they're the hardest ones to follow, and they're the best ones to follow. Plus आजकल there are a lot of stressors, there are environmental stressors, there's a lot of alcohol, smoking, quite a lot of stressors. So a lot of people won't really let that go, but what they can do is probably control or curb the intensity of it. So that is one thing that could be done. And Baki, just eat well, work out, or do any form of physical activity.
The
Not that
cliche
difficult.
answer.
Yeah, not that difficult
Not that
to
difficult.
understand, but very difficult to follow.
Yeah. And also, one needs to understand that these are, it sounds very cliche, but they
Yeah.
have so much of scientific involvement into it. You spoke about that how yeah, alcohol and things like stresses like that hamper your overall growth, including your intimate areas and your organs as well, because these things they harm because the increased level of other hormones like cortisol
Yeah.
and decrease of growth hormone, all these come together when you're having excessive alcohol and smoke. So again, Dr. Pratik, alcohol and smoking has become a part of lifestyle for a lot of people. As an alcohol तो एक socializing का norm बन गया है. People would chill, relax, and a lot of people have taken it as a stress buster as well. Although they know, okay, there are certain side effects, ये होता है, वो होता है. A lot of time people don't feel well the next day, and then everyone's like, कल से नहीं पीऊंगा. But again, the same thing happens. I would like to you to answer this and explain our audience that why one should keep a check on their alcohol and smoking, and how alcohol smoking affects to the health.
So with alcohol, I would say that like people are gonna have it either way. Even I personally do enjoy a glass or two every now and then,
Yeah,
but
yeah.
you have to you have to keep it as a social thing. If If you rely on it to get you off your stress,
Correct.
that's the road you don't want to go down on. With smoking, I would say, I mean, there's nothing good that comes out of it, so there's no upside to it. It's just going to harm you either way, even if you smoke once. Alcohol also, but people won't just let it go. So I think the idea is to help them reduce the intake rather than to stop the intake.
Yeah.
And it works in a lot of different ways, especially with alcohol. Now alcohol is a downer, like whenever we have drugs, alcohol, we classify them as either uppers or downers. Alcohol in very small quantities would give you a slight feeling of euphoria. You'll be high, you'll be dancing, you'll have energy. The moment you cross that threshold, you'll come down. You'll be like groggy, you have slurred speech, and you probably just you won't be able to walk straight, because it acts as a downer. It will suppress your hormones. It affects the level of testosterone in men. It affects the level of estrogen, you know, causing a lot of problems. So smoking is something completely different. It's a whole different evil, probably best avoided. But I mean, the culture is like that you can try and curb it.
Yeah, I mean, and what about those? Is it a myth or a fact that, smoking, say your sperm count decreases? A lot of men, they
Yeah.
think this. So just throw some light on this.
It's a
क्या होता
very
है ऐसा नहीं
it's
होता.
a very strong fact. It's well documented, it's well researched, it's established now, there's no debate over it, that smoking will affect your sperm production. And if your sperm production is not affected, it will affect the quality of the sperms that come out, and it can also lead to congenital anomalies in the kid. So,
Okay, yeah.
but there are also people who come up and say कि मेरे दादाजी तो इतना सिगरेट पीते थे, हमारे तो 7 7 बच्चे हैं.
हाँ हाँ
ठीक है, उनके हो गए, तुमको वो चांस क्यों लेना है?
हाँ,
You know,
उनके में वो स्पर्म नहीं आया.
why do you
हेल्दी
want to
वाला
take
स्पर्म आया.
why do you want to take that risk?
Yeah.
Yeah, some cases the effect, see, every body reacts in a different manner. Doesn't mean that you'll take one example and you'll just go ahead with it. कि हाँ. When it affects you, you won't realize it. The only time you'll realize it is when you're trying to get pregnant. And then when you and your partner, so there's also a very particular situation that's associated with smoking. It's erectile dysfunction. And a lot of smokers face it in the long run. So why go through that? Sexual health is always the last one that people look at.
Exactly.
But when they look at
Exactly.
it, it's already too late.
Yeah, and I think sexual health is one of the most important health as well, because that's how the new life begins.
True.
And like you said, that how the quality of sperm gets affected because of these things. So is there a way, let's say, a person comes to you debating कि नहीं मेरे दादाजी भी बहुत लेते थे, and he in his mind he is not, because I know patients, they're like, okay, you give me medicines, I am not going to change anything
Yeah.
about me. So how would you guide them?
So then I would say a very simple thing. Forget your sexual health.
Yeah.
What's happening to your lungs?
Yeah.
What's happening to your heart? All that is also getting affected. Forget about having kids when you won't be able to walk. So I think a lot of this has to come that even though sexual health is the last thing they look at least the things that can stop them from smoking, be it their respiratory health, be it their cardiac health, even that can help. Or even the nicotine addiction is pretty bad on the brain, because
Yeah,
then the
yeah.
brain needs nicotine to function. That nicotine hit is required, so the withdrawals are also pretty strong. So all that, when somebody's made aware, end of the day, वो उनका ही विल पावर है to come out of it. We can only guide them and provide them with solutions.
Yeah, yeah.
To get out of it is a personal choice there.
Also, do you think because now there's so much rising cases, we hear that about autism, about ADHD, and things like that. Is there a role to play about the not very good functioning sperm on this, or?
Not really, not at least not with ADHD and autism, because there could be a whole lot of causes. It could be genetic mutations. It could be related to the decrease in quality in the eggs and the sperms, not just due to smoking, alcohol, drug abuse, but also due to a delay in childbirth, which is now becoming a trend because people are having children after the age of 35,
Yeah.
which increases the chances of congenital anomalies.
Yeah.
So a lot of things in that perspective, not just smoking and alcohol. But yeah, but I think if we wouldn't have autism, we wouldn't have scientists like Einstein and all, because even they had autism.
Again,
Yeah.
that's so true. And I think, probably one of the reason of, mental health awareness is that we are able to find out, because a
Yeah.
lot of time, from my generation, if you talk about, probably we wouldn't have never known कि अच्छा ऐसा भी कुछ problem है,
No.
I think the good part is that the diagnosis is happening and people are taking action on that, and also knowing the strength that what they have,
Exactly.
So
Yeah.
I think being aware of their health is far more good than not knowing
Not
anything. Actually, tell me, Dr. Pradeep, एक बड़ा taboo कह लो या फिर I don't know, there's some kind of thing in every man's mind about the size of their genital organ.
Yeah.
Yeah, and ये पता नहीं कहाँ से आता है. Firstly, I really don't know. It's because of the movies or because of the conversation. I really don't know why, or the jokes which roams around.
Yeah.
Is anything, as in, is it true that the length really matters, and does it anyhow affect with the the production of kids or anything?
So not at all, not at all. Yeah, a lot of the whole idea that the size matters is because of the adult movie industry, where people are made to look a certain way. And not just for men, even for the women, they also like, everybody is made to look a certain way, and people are like, okay, maybe this is how everyone should be. Like, everybody should have a perfect body, and that's not what happens in real life. And people have to realize that they are all actors. For them, it's a set. That shoot would probably go on for 6 hours. So it's a set. So people get very wrong ideas when they look at those movies and make assumptions from it. Now people can have preferences of size, but would it affect their sexual life, the pleasure, and anything related to fertility? Not at all. So, and every time somebody asks me this doubt, कि size बड़ा होना चाहिए, मतलब नहीं, दिल बड़ा होना चाहिए तुम्हारा.
But how funny it is that how this doubt raises in so many people. There was recently a movie also in it. I mean, it was a comedy movie. I don't remember. Akshay Kumar tha ya kaun tha? I don't remember. So there was some
Okay.
movie where the teenager child is having doubts like this. So okay, let's say an adult would understand. How would you guide a teenager?
No, even adults don't understand, because a lot of things that happens, how our minds are sort of affected by things work in two or three different manner. One aspect of it is insecurity. So when you look at these bodies, when you look at these really large sized, genital organs, people just are very confused. People are like, no, I mean, this is how it should be. And then they go into self doubt. That leads to a lack of self confidence. That's also one of the causes for erectile dysfunction. Because now when they're getting intimate with their partner, they're thinking that maybe I'm not that good. And that cycle leads, because once you've had an episode of erectile dysfunction, the next time you go into the act, you'll be only be thinking, okay, I couldn't get erect the last time. Maybe it won't happen this time also. So now you're trapped in a vicious cycle.
Yeah.
So
I'm
that
sure
quite
because-
happens. So
yeah.
insecurity, I mean, be it with not just this, be it any product even that we buy, how is it pushed to us? Insecurity. If you don't have this, you won't be able to get this. Something like that. So,
Yeah, sell what people are fearing
Yeah.
of, right? I know, it's such a vicious circle.
yeah, that's the same thing happens with this, and it does not really affect your sexual life, because it is well documented that most of the nerve endings are outside, are on the external genitalia, not on the inside. So no matter how big your organ is, it's not going to do any good. It might actually cause more pain and might lead to just your partner not actually wanting to get involved with you then.
That's so true. And actually, I think one needs to understand this fact so clearly. And, like you're saying, once you are in an act of with your partner, stresses like this, of course, won't give you pleasure as well.
Yeah.
आजकल बहुत ये भी हो रहा है that again the biohackers they are coming up with various ways that okay supporting the statement,
Yeah.
okay, size matters, things like that. There's some stem cell things also people are getting done in their reproductive organ, which I found is, I don't know, I'm trying it to be true, I don't know much about it. But again, things like this, people who are experimenting or calling themselves biohacker and doing it, I don't know whether they're getting any benefit out of it. But these kind of conversation is also creating some kind of doubt in people who are not able to afford or not, able to find that resource.
Yeah.
What do you have to say about that?
So anything that says that the size can be increased is a scam. There's only one short way of doing it. It's a surgery. And in the surgery has so many cons that a urologist himself would never recommend it to you. It's one of those surgeries where you might not have an upside because all you're doing is releasing the extra tissue that's already inside the body, so it'll give you probably an inch more. That's about it. But loosening because it's held by ligaments, you cut those ligaments, so you also lose you can there's a very high chance you will lose your natural erection for your whole life. So the cons are so much that nobody recommends the surgery, and that's the only way that's available. Everything else is a gimmick.
Yeah, and what about the stem cell thing? Like,
That also wouldn't work because see, for any particular organ to grow in size, be it your body, be it any muscle, you would require some muscle tissue in your body.
yeah, yeah.
Yeah, but in penises there's no muscle. There's just a sheath and a spongy cells, but that's all, which only react to the blood flow that comes and fills those cells, and it expands. That's it. There's no muscle, there's no bone, so there's no chance of growing the already existing tissue.
Yeah, I mean, actually, it completely makes sense scientifically. Because I do follow some of the biohackers, the popular ones from
Yeah.
LA as well. So they are kind of very experimental with their everything.
Yeah.
So, which I found very, very, weird and crazy as well. I think with age, there are certain changes which one needs to accept and work on it.
Yeah. See, there's a workaround for everything. You can live a healthier life even with age. You can have, you can still have a good sexual life no matter what your age is. It's just that with these biohackers, no, they would always target something. If you're not afraid of anything, they'll create a fear in your mind. And plus, the claims that they make, they are so baseless. And their source article would be an article in Cosmopolitan or Vogue. That's
Yeah,
not how
yeah.
medicine works.
Yeah, is it so?
Yeah, if you go and just look at the source articles,
Uh-huh.
it would be coming from a magazine. Plus there are quite a few celebrities, very famous ones, especially in LA, who have such weird publications.
Yeah,
And I'm pretty sure you know who I'm talking about. So,
yeah. But I mean, the gossips are pretty interesting, by
Yeah.
the way. It's just a lot of spice there.
a lot of spice. So
Yeah.
when they come up with such stuff, people tend to believe it very quickly.
Yeah, I know, and it's so difficult for a doctor or a person who understands the subject so well to make their clients important and make them understand that
Yeah.
okay, yes, I have, because they are looking at their idol who is doing XYZ hacking
Exactly.
and whatnot. Speaking about hack, there's so many things, like Ozempic and growth hormone and things like that. Again, let's wait for some more years to science,
Yeah.
what science says about it. I think it's still very fresh and new. Let's see what happens with.
I think this is what people need to understand, that as doctors on social media, all we are doing is damage control. Because we would say something, and some random person of any other field would say something absolutely different. People would rather believe that
Yeah.
than a doctor, and then they would come and sort of ask us that maybe you are wrong. You should go and look at this. Like, why should we go and look at this?
Hey, but Dr. Pratik, you can't say that because
Yeah.
you have a good following, and I can clearly see that
No.
the content which you provide is very you make people understand very, very nicely. A very technical term you simplify and make them understand. So I think probably you can be the one of the celebrities that people are looking to
I-
you and listening to you.
I would not know about that, because in our field also,
Yeah.
especially in fertility, I mean, there are pages who are treating PCOS. I mean, we know that there's no cure. You can manage
Yeah,
PCOS. You can,
absolutely.
you can treat it for a lifetime, but you cannot cure it. But there are pages who are claiming that oh, बस हमारा ये powder लो तुम cure हो जाओगे PCOS. And people are engaging with them left, right, and center. They're buying their packages, paying I don't know how many thousands a month, and then they come to doctor and say कि नहीं हो जाता है PCOS तो cure. And when it's too late, when the condition has worsened,
Yeah.
the PCOS has gone unchecked, and then they come to us and they're like हम तो 5 साल से ये ले रहे हैं. You know.
I mean, that's really sad that how
Yeah.
marketing gimmicks impact in our mind, and particularly people who have certain kind of issues. They, of course, are looking for some solution.
Yeah.
And we get victimized a lot of time through these marketing hacks. I also wonder that, PCOS, again, it's related to hormones, like androgens and things like that. A lot of people are trying to cure the hormones rather than looking at कि अच्छा ये हो क्यों रहा है, basically focusing
Yeah.
on the gland, that what is the reason this is happening. And that is why one of the reason that okay, the relief is, most of the cases we see okay, PCOS चल ही रहा है for 5 years and things like that.
Yeah.
And recently I got to know there's some tea also for PCOS. It's called PCOS tea. Or
Wow.
supports your PCOS, something like that. So yeah, I think whatever people can. And
Yeah.
अब तो बस ये हो गया राशन पे भी लिखा हुआ हो, beans supporting your PCOS, rice supporting your glycemic index. Rice के साथ तो होने लगा है.
Yeah, brown. There was such a big differentiation between brown rice and white rice.
And
Have
red
this.
rice, there's
Yeah,
red
and red
rice
rice
also. I know. And then every day somebody is coming on Instagram that Chani, you should eat this का ये drawback है, इसका ये oh my god. I can completely understand the consumer's mindset कि किसकी सुने किसकी ना सुने, right?
Yeah, that's true. That's true.
Yeah.
And it's usually the people who are more famous जिनको लोग सुनते हैं. And it's usually not doctors.
That's true, because we don't have the skill.
Yeah, we don't have the skill or the
camera skill.
Exactly.
The camera art.
So then all we are doing is a damage control. We're just trying to turn back what has already been done.
So what kind of DMs do you get? Like what kind of questions do people ask you?
So a lot of them are usually related to them not being able to conceive, or men suffering from erectile dysfunction, premature ejaculation, or people just having basic doubts. Even something as basic as how to wear a condom, because people will buy condoms that they will wear it not properly, or they will damage it in the process with their nails or whatever, and then the contraception would fail. And so a lot of very basic doubts, everything from sexual well-being to them suffering from infertility and trying to conceive. So then accordingly I help them.
And do women also reach you
Yeah.
for the questions, and what kind of questions are they, if you want to share?
For them, either it's related to their partners, or it's straight up related to vaginal dryness, especially in postmenopausal audience that I have. For them, vaginal dryness is a big thing. For people who are very young, around the bracket of 25 to 30, for them, it's a lot of menstrual health related questions, a lot of period pain related questions. And when it comes to infertility, it's usually the women only messaging that my husband is going through this, and we want to try and get a consultation and all. So these are the type of questions.
Speaking about menstrual health, how would you guide a girl who just recently got her first period and is completely messed up, and of course there's a lot of pain for a lot of people out there? What do you recommend?
So one of the things that you have to make them understand is that it's absolutely normal, and you're not the only one going through this. Once that has set in, then you try to explain it to them in as simple words as possible. What is happening with your body? It's normal. It's a period. Explain what a period is, why it happens, and I think that should sensitize them. And then it's a lot of back and forth. Like you just don't have to do. You can't just do it once and just leave.
Correct.
It will be a lot of supporting them through for at least the next few months or years, depending on how perceptive to the information they are. And then maybe then they will be more happy. And then they will also be able to discuss it more openly. For the pain, there are a lot of ways to soothe the pain. And if it's too unbearable, we also have medications available, painkillers. So instead of having a taboo against painkillers, when the pain is too unbearable.
Is it?
Oh yeah. It's quite a bit. Like people are proud of not taking painkillers and bearing the pain, not being able to get out of the bed.
Why?
I have no idea because I think it's been passed along the generations that दवाइयाँ नहीं लेनी है, ये तो ऐसे ही कुछ
क्या
body
होगा
का.
दवाइयाँ
हाँ.
लेने से?
And
What do you think? क्या होगा painkiller if they take them?
it can mess up with their periods. It can make them irregular, or it
Oh my god.
like there's also a very a jarring concept that has been passed on along is that you are supposed to endure this pain.
Why?
I don't know. That's the question I ask. Why? बोलते नहीं हमारी दादी ने बोला है, हमारे परदादी ने बोला है, हमारी मम्मी ने बोला है. You have to endure this pain because this is period is, I don't know, washing off a sin or something. I was
Oh
like,
my
wow.
god, I can't believe कि अभी भी ये सब thoughts
Yeah, it
है,
happens. It's very, very recent. All these things still happen.
Poor child, because itself is a kind of a shocking thing,
Yeah.
going through it for the first time and ऊपर से ऐसा support. In fact, a lot of countries I know that they celebrate.
Yeah, the
having,
first period.
Yeah, I mean they like literally it's a kind of a festival for them.
Yeah.
So I think things like that boost the confidence so much. Okay, you're not different. You're just going through, which is a normal process.
Yeah.
I mean, I wish we could also have done, things.
True. I mean, no matter. I mean, see, there's a very famous controversy. Like there's a very famous line that people in period shouldn't go to places of worship.
Yeah. I know that.
Now, how it started was a completely different thing. When it started, it was they weren't asked to go to the place of worship, not because they shouldn't, but because they were in so much pain that they were asked to rest. And as the generation passed, it turned into, oh no, you should not go to a place of worship because it's impure. So from like how the same information has traveled through generations to what has become now, it's completely different than the initial reason was, and now people believe that.
Yeah, no, that's so sad. In fact, a lot of my friends, were growing up have been doing this practice.
Yeah.
Because I'm Bengali and Durga Puja हमारे में होता है. So I would take my friends to Pandal and they'll say, no, we are chumming, we can't go and things like that. And like you are there, you're not even touching the goddess. You're just attending, we cannot. And actually they would miss so many things believing on this, no, you have to.
Exactly.
I mean, if it is related to hygiene and things like that, it is understandable. Okay, if it is related to pain and all, like, you need to rest, you need to, give some time to your body rather than being out there all the time and taking so much stress. But beliefs like this, I really pity on.
And they're still very prevalent. It's not like, I mean, even in the section of the people who are well educated, the beliefs are still very, very prevalent. So, I mean, I don't know. Maybe it'll take a lot of years for it to change, but hopefully it will happen.
Yeah, hopefully the coming generation should be, they are much more well aware, they are sensitized. I mean, they speak about stuff very openly and boldly.
Yeah.
So I'm sure
I
there
think
would be some change.
They are hyper aware.
Yeah, and they hyper react.
Yeah, they hyper react. That's another discussion.
I know. I have kids that age, so yeah, I mean, not related to like as a mother, but in general, I think the knowledge is very, very up to the mark, and they have opinion for everything, which is good as well. I mean, that's again a different subject altogether.
That's a whole different subject, yeah.
So, Dr. Pratik, since you are continuously working with people who want kids, who are coming to you, ki acha, just help us out with that. And then there is this belief also that a lot of people want certain kind of, maybe boy, maybe girl, or there are choices.
Yeah.
Because we have seen this in our history as well. History meaning like we have seen our, how in our society things happen.
Yeah.
So how would, let's say they come to you and they will say, okay, नहीं हमारे को तो लड़का ही चाहिए. डॉक्टर साहब आप जब आप कर ही रहे हो तो हमको लड़का ही दे दो. ऐसा होता है क्या?
बिल्कुल होता है. It's very common.
And then what's your reaction?
We can't offer that service to them.
We can't offer that service.
Simple. I mean, we will say that हम embryo transfer करेंगे, लड़का होगा लड़की होगा वो हमारे हाथ में नहीं है. Because it's illegal in India. sex selection is illegal.
Absolutely. And it's
Bec-
unethical
it's
also.
unethical,
Yeah,
and you know because we have a history of female feticide.
exactly.
So in that particular case, it's illegal. But I mean, you can go see now when people really want it to happen, they usually go to countries like Dubai or Singapore, where it's legal. So over there, what they will do is they'll take the embryo. And because embryo is already been made in a lab,
Right.
so they'll do a genetic test of it and see if it's a male or a female embryo, and then transfer the one that they're requesting. Now, in countries it is legal, it can be done. In India, it's not legal. So even the genetic tests done in India, the reports that we get from the center which does the tests, they do not include or they do not test for the gender of the baby. So you will be completely oblivious to it, and the report you get will be only on the genetic mutations, if any, or the euploidy, which means if the numbers of
Correct.
the DNA is the correct number or not. That's about it.
That's so important. I really respect this kind of work ethic which
Yeah.
we are following. But I really want to tell our audience that okay, why a boy and girl is not in our hands. Also, in not being an embryologist as
Yeah.
well. Like because ये होता नहीं है कि a lot of times एक अच्छा पहले तो बहुत ही lack of understanding थे, अभी तो people are still aware about the chromosomes and things like that. So give us a little bit knowledge on.
So what happens now? We have seen this, that Hamesha, it's the women who are blamed for a girl child.
Right.
Right. The reality is very different. And जो पिछले 20-30 सालों में जो स्कूल से निकले हैं, सबकी किताबों में 8th 9th स्टैंडर्ड में एक रिप्रोडक्शन का चैप्टर होता है.
Absolutely.
ठीक है, उसमें बताया होता है कि एग से आता है एक्स क्रोमोसोम. ठीक है, अब बॉयज़ में भी एक्स होता है, गर्ल्स में भी एक्स होता है. तो फीमेल से जो एग आ रहा है वो तो डिसाइड नहीं करेगा द जेंडर ऑफ द बेबी. स्पर्म्स दो तरह के होते हैं, एक एक्स के साथ, एक वाई के साथ. अगर एक्स वाला ही स्पर्म आ रहा है तो एक्स और एक्स मिलके बनेंगे फीमेल, एक्स और वाई मिलके बनेंगे मेल. तो जेंडर डिसाइड करता है स्पर्म, नॉट द एग.
Yeah, so please make it loud
Yeah.
and clear. Gender decide करता है sperm, not the female.
Not the egg. And it's not even in the hands of the guy कि
Yeah.
कौन सा sperm fertilize करेगा.
Exactly, because
That's random.
it's not robotic, right?
Yeah, it's
You cannot
completely random.
plan it. That's
Yeah.
true. That's true.
So while the sperm cell is responsible, there is no control over it. And there's no way you can increase Y sperm cells वाले sperm या X DNA वाले sperm. ऐसा कुछ नहीं कर सकते. It's completely random. And there's no position you can try which will increase the chances of a boy, or
I
there's a lot of
I know
things.
so much of knowledge circulating in Google about various things. How funny is that? So what are the kind of challenges do you face in your regular practice? Like
A lot of the times it's the people, especially people who come from tier 2, tier 3 cities, they want to keep it really discreet कि हम IVF करा रहे हैं. उनको नहीं बताना, उनको अपने घर में नहीं बताना. So they would want us to not include it in the file, but we cannot do that. हमको तो फाइल में वही लिखना है जो करा है, because as doctors you have to safeguard ourselves first.
Absolutely.
So then we will put it in their files and they will be like नहीं घर पे कोई फाइल दिखेगा तो मैंने कहा घर पे तुम फाइल के साथ क्या करते हो तुम्हारी इच्छा है, हमारे पास तो हमारी रिपोर्ट होनी चाहिए. वी कैन नॉट फॉल्सिफाई. तुम घर जाके जितना दिखाना है उतना दिखाओ, वो तुम्हारी इच्छा है. दैट नोबडी कैन कंट्रोल. बट हमारे साइड से सब कुछ आएगा. देन स्पेशली व्हेन पीपल आर गोइंग फॉर डोनर स्पर्म्स और डोनर एग्स, तो अब तो काफ़ी द ART लॉ विच गवर्न्स द IVF प्रैक्टिस इन इंडिया हैज़ नाउ चेंज्ड क्वाइट अ बिट. तो उसके साथ जाना पड़ता है. बट इनिशियली तो पीपल वर वेरी दे वांटेड नोन डोनर्स. अपने घर से ही किसी को ले आते थे कि हमको इसी का स्पर्म चलेगा. बट वी वर लाइक नो, द डोनर शुड ऑलवेज बी एनोनिमस. तो
My
हम
God.
सीमेन बैंक से जो मंगाएंगे वो यूज़ करेंगे.
Yeah.
तो आगे जाके घर में कुछ प्रॉब्लम हो, कल को आके बोले कि हॉस्पिटल ने हमारा इसका स्पर्म लेके गए. You never know what happens.
Oh, so the movies like it, I'm like so Bollywood buff. I'm bringing movies all the time. वो good news वगैरह जो movies
हाँ,
थी, so that was also on this subject, right?
Yeah, that was on the subject of mixing of samples.
Yeah. So does that happen?
It happens. Not so much. See it. If you go and look at the market of the US, it happens quite a bit. I mean, there are a lot of cases. There was one Asian couple or one white couple who had given birth to twins, apparently twins, because two embryos were transferred or three embryos were transferred and two implanted. One was a black baby, the other was an Asian baby. That was
Oh my God.
that was a pretty big case.
That's hilarious. Huh?
So after that, a lot of parents sued a lot of IVF centers in the US.
Yeah.
Because the working over there is pretty different from our. They would do a lot of cases, or simultaneously, or I mean, I'm not really sure, but over there the mixing cases at a certain point of time were on a rise. Now a lot of things have come in place to check which sample you're using, so a lot of alarms go. In
Okay.
India it wasn't as much because the volume has always been pretty manageable in India. Like even if a center is doing 150 cases a month,
Yeah.
which is probably the peak in IVF, that 150 cases a month is happening. And even those centers are very less, a very handful of centers in India are doing that amount of volume. They usually have a team which rotates. In US it's a little different, so maybe that could be the reason. But yeah, in India it doesn't happen much, or even if it happens, the reporting is not that much, I would say.
Okay.
So
That means must not be happening. I mean, not
Yeah.
much.
must not
The
be happening
percentage
much,
is
or
very,
a
very-
lot of time it's not reported also, because in India there's a lot of taboo around IVF, so people just like go with it.
Yeah.
That could be one thing, but because I personally haven't seen it happen a lot
Uh-huh.
in the field, in my years of working, I probably would have heard of 4 or 5 cases
Gotcha.
across
Then
the
that's
board.
barely anything.
Yeah, I mean, it's really painful when it happens.
I'm sure.
There are ways to manage it. There are ways to like how in the movie they finally accepted whatever is happening. That's obviously one way. So, but it does. I mean, in the world, I mean, it does happen. Like we cannot say that it never happens. It's a quite possibility that it could happen.
When was the first IVF thing came in India? And how old is this IVF
So
process?
the first baby in the world was born in 1978 in July 25th. It was in
1978.
it was in London.
Okay.
That was the first baby, and
That was a lab experiment, or was it
no,
there
that
already?
was they were trying. That cycle was also not a stimulated cycle, like how now we give ovarian stimulation drugs. That was a natural cycle. The doctors Robert Edwards and Patrick Steptoe, and the embryologist at that time was Jean Prudy. She was also acknowledged very late, after like posthumously she was acknowledged. Like nobody was even aware of her name.
Wow.
So then that happened. Louis Brown, she's the child. Even now, and now she also has her own daughters who were conceived naturally.
Uh-huh.
So it's such a long history, like 50 years now.
Yeah, 78.
Yeah,
Yeah,
so 50
must
years,
be.
almost 45, 46 years, whatever it
Exactly.
is. And then the interesting thing was that within 3 months of the first baby in the world, India had its first baby and world's second baby
Oh, wow.
on October 3rd in the same year, 1978.
So first baby in India, like through Indian IVF,
Was
and
3rd
second
October.
baby in the world.
Yeah, was the second baby in the world.
Wow.
So we were literally one of the first countries neck to neck, and this was a stimulated cycle, not a natural cycle like how it was in the UK. And it was Dr. Subhash Mukhopadhyay.
Wow.
Now initially,
I mean, India
yeah.
has been excelling
Yeah.
since so many years.
yeah, but then we took a hit because the government didn't recognize the concept of IVF, and the doctor was pretty, like, all the research was destroyed, burned, and the doctor
God.
went into depression and ended up committing suicide.
You were mentioning there was a movie also, no?
Yeah, there was a movie that came on it called like Dr. Ki Maut, which
my
was
God.
way back. But then, and the child born through that cycle, Durga, she still visits our IVF conferences. She's still a guest of honor in those conferences. Even the first baby, Louis Brown, she also visits the conferences in India and across the world as a guest of honor.
Lovely.
Yeah.
That's so
Yeah.
beautiful story to hear, that how the first IVF and the second IVF baby
Yeah.
are around, and they're
They are like the trendsetters of IVF.
I know.
They were the ones who started it all.
I know. Wow, what an interesting story. So, we covered a lot of topic, Dr. Preeti. So we are almost around the closing of our podcast now. One question which I really wanted to ask you since the entire conversation. Okay, so when you start doing this video, the one day which you thought, okay, let me make video.
Yeah.
Okay, so what was that thought in your mind, and how did your family react to that?
So I'm very blessed with the kind of parents I have.
Yeah.
They are absolutely chill because they have only educated me around all these topics since I was very young. So for me, it was very normal to speak about these things. Yeah, my extended family, I have no idea how they would have reacted because
You
nobody
think-
comes to me and says
They
anything.
don't?
No,
वो
no.
family gatherings में नहीं
No,
आते?
nobody comes to me and
चाची,
says
मामी,
anything.
nothing. Okay.
Nothing. So that way I'm pretty blessed.
Yeah.
But how it started was that I was uploading static posts. I wasn't putting myself on the platform. Then a few of my friends, they were making a reel on COVID vaccination and just the awareness and the drive around it. So they were like, listen, no, you have to come on the camera. I was like, I cannot do it. Like, no, you just come, see how it goes. It's because we are a few people inside in the whole reel, so the segment will be very short. Just come and see how it feels. I was like, okay. I did that, and after that they were like, okay, now you cannot go back. Now you just have to shoot videos. It's like, fine, I'll try.
Interesting. I mean,
Yeah.
thanks to your friends, we
Yeah.
are getting good content, and I'm sure people are learning from this content a lot. So, since we are concluding our podcast today, just give us some, awareness tips for men and women, for both,
Okay, I mean,
separately.
yeah, it's a very vague, very big blanket that we can cover with these
Let's
tips.
say 5.
Okay, I'll try to think of 5 because if you ask me specific, no, I would come up with. But okay, so for men, one of the things I would say is that if you have if you're going through some sexual dysfunction, everyone in their life at some point would go through it. Don't consider it a setback or a taboo, and don't be ashamed of it and not seek treatment, because then it will go on.
Yeah.
Be open to it, just seek treatment, and whatever the cause, be it psychological, be it pathological, it can be treated. So the more you normalize it, the better you'll get. Otherwise you'll just be stuck in it. For women, I would say that a lot of times they're pretty subdued in the terms of what they want, because as women, especially in this country, they're very sexually repressed. It has always been a very patriarchal society that we have lived in. So
Correct.
the men's need has always come first, and everything else came secondary. So with the changing times, I think people should be more open to how they want a certain aspect of their life to go. Be it their career, be it their sexual relationships, be it their life. No? So they should be more open about it, rather than, because now the times are changing, and we are seeing that it in our practice also, because now people want to delay childbirth. Another point I can add to that is that we have egg freezing available now all across the world. If you want to delay your childbirth, freeze your eggs and freeze your
Utilize that.
sperms.
Yeah.
At least your good quality gametes would be stored whenever you want to use them. So yeah.
Great. So yeah, I mean, I got that. So for men, you need to talk more if you're facing any kind of challenges related to your reproductive organ. And for women, set your priorities and be strong. Come out with your priorities.
Yeah.
Decide what you want. I think it is an hour of change. And of course, freeze your eggs if you want to delay your pregnancy. Thank you so much. It was lovely conversation and a lot of information we had. Thank you.
Thank you for having me.